Good morning. Welcome to breakfast at UMHealth. I am Associate Professor Dr. Mang Chek from Department of Paediatric Dentistry and Orthodontics, Faculty of Dentistry, University Malaya. This is a breakfast at UMHealth, so it means you can have your breakfast as we listen to the webinar. And with us this morning are two prominent speakers from Faculty of Dentistry. They are Professor Mohamad Rahman and Dr. Lau May Nak. We will start with the first speaker, Professor Mohamad Rahman, who completed his Bachelor of Science in 1993 and Master of Science in 1995 in Microbiology from the University of Dhaka, Master of Science 1998 and PhD 2001 in Biochemistry from KU Leuven in Belgium. He worked at University of Fukui, Japan as Center of Excellence Researcher in the field of neuroscience from 2004 to 2005. In a span of about 25 years of academic and research career, he worked at Khulna University, 1996 to 2003, East West University, Dhaka in 2004, and International Islamic University, Malaysia, 2005 to 2015. Since July 2015, he is attached with the Faculty of Dentistry, University of Malaya. Prof. Tariq's research interests includes in vitro stem cell propagation, immunology of wound healing, immunology of periodontal diseases, immunological responses of pharmacology of natural products. And Prof. Tariq is the founding president of the Malaysian Society of Oral Microbiology and Oral Immunology. Currently, Prof. Tariq is serving as the executive editor of the Annals of Dentistry, University of Malaya, the official journal of the Faculty of Dentistry of University of Malaya. And today he's going to introduce to us about how we should boost our immunity, especially in this current pandemic situation. And it would be very interesting to hear what Prof. Tariq can advise us. Please, Prof. Tariq, it's your floor. You can continue.
All right. Good morning, and thank you very much, Dr. Mang Chek, for the nice and very brief introduction. It is my pleasure to join this breakfast session with a topic which I prepared mostly to remind myself and all of us so that we can remain healthy. I am confident that most of the contents of these presentations are known to many of us, but at the end, I believe that this reminder will be beneficial to remain healthy, especially in these new normal living conditions. I shall begin with a simple and layman definition of immunity, which refers to ability to remain healthy. In other words, it is referring to the ability to fight any insult to our health. These insult or challenges could be environmental origin, could be microbiological like bacteria and virus, could be psychological like stress, and it also could be physical like injuries and some other factors there. Of course, there are genetic factors which also lead to weakening immune system of an individual. So we have hereditary immune disorders. All those ability of immunity is coming through a number of cells in our body. We basically have millions of cells of different types. We categorize them as lymphocytes. And we also have molecules like antibody and cytokines. They are these are all the tools to offer immunity for us to remain healthy. In fact, this immunity is providing us the tools to make a balance whether we can become sick or we can remain healthy. So all the tools that immunity that we have through our immunity, it will protect us from sickness so that we can remain healthy. Now I shall try to explain that balance in terms of the functions of different parts of our body, different organs of our body. What you see here in the center of this slide in the yellow circle is different parts or organs of the body, including the soul. And each of those organs at the end are made up of cells. And each cell, although in a different composition, they contain nucleic acids like DNA, RNA, of course, water, proteins, hormones, enzymes, and so on. And these organs are involved in different functions of our body, physiological functions of our body. For example, lungs are involved in the respirations, heart is in the blood circulations, brain for thinking, understanding, and heart is also for emotion and desire. So if there is any imbalance to any of those functions or any of the composition of the cells, any imbalance to it, as I'm showing it with this small cartoon, it can lead to different kinds of disease sickness. And this sickness could be organ specific. For example, Alzheimer's and Parkinson's could be brain specific disease, or it could be anywhere in the body. For example, cancer can be anywhere in our body, in any organs of our body. So at the individual scale or the individual domain, we need both a physiological balance or physiological well-being, as well as the psychological balance or psychological well-being. In addition to these well-beings, we also need spiritual well-being. Please note that we can have either religious spirituality or can have non-religious spirituality. On top of this individual domain, we also are affected by the societal domains, which constitutes many issues like family, economic, socioeconomic structures, racial compositions, or occupational status, and so on. So all those factors also contribute to our health status. And finally, on top of everything, we have these environmental conditions, which is referring to the climatic situation or any potential or possible pollution factors in the environment. So although they are separated, but they're all connected to each other, and then eventually it contributes to the individual's healthy living. Now, in each of those domains, we have boosting factors or damaging factors in terms of our immunity. For example, if you look at the environmental factors, societal factors, or individual factors, these factors I'm listing here can boost our immunity. On the other hand, these are the factors which I'm listing down here. They can damage our immunity. I shall highlight some of these factors in the subsequent slides, and not all of them, of course, because it will take a long time to explain all of them. So only a few of them will be discussed in the subsequent slides. So, all right. Although our immunity is factor dependent, and those factors comes from different domains that we are in at our individual level, or at the societal level, or environmental level. But the fact is that we are born with a tremendous, powerful immune system in our body that I call them as a Herculean ability to remain healthy. If you notice that some of the children from their early age, they basically can crawl on the ground, and then they pick up any dirty things and they put it in their mouth, but still they do not become deadly sick in many cases. And that actually, or you can imagine that in a baby, until at least 2 years of their age, they only live on breast milk or some other formula milk. So they do not need anything else. So that meal provides them, enough nourishment, and at the same time, that milk is not everything, because after adult age, we cannot live on milk only. We need many other nutrients. So what I'm trying to tell you is that at the earlier stage, basically, the life is equipped, the body is equipped with a tremendous ability to remain healthy, and that's what we are. Now, where does this immunity comes from? As I was trying to tell you in the beginning, that we have millions of cells in our body, and also we have different kinds of molecules like antibodies and hormones, cytokines. Those are the cells and molecules that are the tools that we have that offers the immunity. So as you can see from these a very complicated network of cells, that many of those things, their functions are interconnected, and in each cell that we do not only have these molecules inside, but also we have molecules on the surface of the cells. So all those molecules are also involved to provide us the immune strength, and those molecules can be interconnecting. For example, these molecules from one cell is connected with another molecules of another cells, and these interconnections and connectivity and their signal transduction from one cell to another cell, and eventually from one organ to another organ, it is is so powerful and so complicated, but still it is very, very useful to fight the consistent and constant challenges that we're facing every day, and eventually it can provide us with a good health. Now, I shall try to highlight some of the things that we can do which can boost our immunity, or which can avoid to do certain things that can damage our immunity. So I shall start with this thing that we can do, which is stretching our body. I'm not sure whether many of you, or any of you do it, but it is a very good practice that when you wake up early in the morning and then you stretch your body, basically it will help us to reduce the inflammatory factors in our connective tissues, in the muscles and in the bones that we have. And people have identified that this stretching is a very good, it is very helpful even to treat the cancer patients. And not only the treatment, but also it can prevent, cancer progression. So there are other scientific studies that are, I'm citing one of them here, is that like yoga kind of stretching, it can reduce stress and enhance our mucosal immune function, especially those who are older. So in other words, this stretching, at different time, like when we wake up in the morning, or when we are working in the office, let's say every 2 or 3 hours, and if we stretch our body, it can boost our immunity a lot. From stretching, I'm going to another factor, which is stress, right? I think we are all aware of this situation, that is stressful situation in the modern time, because more or less we are stressed for different reasons. Now, physiologically speaking, stress can be very helpful in certain conditions, because it increases our blood pressure, it increases our respiratory rate, perspiration, and even muscle tone. So in certain conditions, this stress is helpful because it can result in a fight or a flight reaction or response for ourselves. But imagine that all these functions are a very continuous process, and it is continuously happening in our body, then definitely it is not a good thing for us. And there are, a tremendous number of citations that you can see in the literature, in the research has been done to see that how stress basically can weaken our good health, which is connected with our immunity. It means that it is actually a damaging factor for our immunity. It is better to be more relaxed than stressful, because stressful condition is not good for our health. But on the other hand, if we are relaxed, whether we are relaxed for a shorter time or for a longer period of time, that it can boost our immunity significantly. For example, if someone is having a relaxed for a certain period of time in a week, and then there will be an increased number of immunoglobulins of different types in the serum. At the same time, it can also increase the immunoglobulins in our saliva. So all those immunoglobulins are basically a very important tool to fight any infectious disease and many other immune functions. So in other words, having a relaxed situation, or even a dedicated time in a day, if you try to have a practice of relaxing, then it is a very important boosting factor for your immunity. So it is not only the relaxation, but also the sleep cycle that is very important for our healthy living. In a daily routine, that we need a certain time period, certain hours to get into sleep, and it actually controls or regulated by the circadian rhythm, the natural cycle, and it follows the sunset and sunrise. So this sleep cycle is very important. If you notice it that these sleep cycle, if it is obstructed, then the digestive functions are affected. At the same time, short sleep can increase the risk of cardiovascular diseases, hypertension, and some other problems with the heart. And as well as the short sleep duration, it basically can increase your appetite for food intake, and which eventually can lead to obesity and other health problems. Now I shall talk about the different aspects of our immunity, which is affected by some of our actions, especially the psychological actions like emotions. We have negative emotions, or what we sometimes call as the toxic emotions like anger and hatred. These toxic emotions can adversely affect our immune ability. For instance, as you can see that anger can result in a significant inhibition of the salivary immunoglobulin or antibody production if someone is, remain angry for 5 hours or something like that. And from another study, it is shown that anger, whether you express it or you suppress it, it basically can lead to a certain heart-related diseases. But it's not only this part, but if you look at this particular diagram, you can see that a number of hormones which are eventually affecting the expression of many of those cells, and all of them are very important for our immune functions. And these hormones are also affected. Expression of these hormones are affected by our emotions like anger and hatred. Contrary to those negative emotions or toxic emotions like anger and hatred, a smile or laughter, it basically can boost our immunity. If you remember that we have talked about this anxiety and stress that can negatively affect our immunity. On the other hand, this laughter basically can decrease our anxiety and stress. In other words, it actually boosts our immune ability. And it was shown in some studies that laughter therapy or smiling therapy, it helps to improve the quality of life of older people, especially who are living in the old care centers. There was another study which also shown that laughter therapy is beneficial even in a clinical setting for cancer treatment. In addition to our ability to have a smiling face, we also can achieve the virtue of forgiveness, because this forgiving mentality, it helps us to reduce anger. And if it reduces anger, it means that it actually can help our immunity to be boosted. It was shown that the lower forgiveness, it is associated with poorer health habits like alcohol consumption and cigarette use, which negatively affect our health through damaging our immune system. So having the forgiving virtues is very important for our healthy living or boosting our immunity. In addition to those toxic emotions, we also have some positive desire. For example, a desire for eating good foods. This is also not always good, because if you may remember that a Japanese scientist named Yoshiniro Oshumi, he discovered a phenomenon called autophagy, a cellular phenomenon, and this is connected with this intermittent fasting or periodic starvation, in other words. And if we have this intermittent fasting or periodic starvation, that can lead to autophagy. And using this cellular phenomenon, we can eliminate some of the unused or harmful components of the cells. Now, these kind of behavior, like periodic starvation or fasting, it increases the functional adaptation of our livers and intestine. In other words, the ability to digest foods. It also reduces the expression of pro-inflammatory cytokines, and many of the time that these are very harmful for our good health. And more interestingly, that these periodic starvation or fasting also help us if especially those cancer patients who are undergoing the cancer therapy, because the side effects of cancer therapy can be minimized by this periodic starvation. In addition to the needs for a controlled food intake, we also have to be careful about taking or having cold drinks, because once we are taking the cold drinks, it basically reduces the temperature in our stomach and small intestine compared to our large intestine temperature. And these temperature variation can lead to irritation in the small and large intestine. Eventually, it can lead to diarrhea, dysentery, and colitis. So all of those things are happening because of these reduced immune activity in the digestive system. More deadlier than the cold drinks is smoking and alcohol drinking, because these two habits, smoking and alcohol drinking, it can destroy our innate immunity and adaptive immunity. I think you may know that we have two different types of immune ability. One kind of ability that we are born with, that whenever we are born we have those ability, and the other kind of immune ability is that we acquire it. It means that whenever we are facing certain challenges or infections, then we produce some antibody against it. This belongs to adaptive immunity. Now, this smoking, it actually can destroy the innate immunity of our respiratory systems. Like, it can destroy the ciliary epithelium cells, it can destroy the lung surfactant proteins, and so on. On the other hand, the alcohol consumption, it actually reduces the inflammatory responses, and it destroys the adaptive immune system to the extent that it can lead to very organ-specific failure due to the immune-mediated effects. Now, I have come to the second last slide of my presentation, and in these two slides I shall try to explain two very important aspects that can boost our immunity. The first of all, it is about the cleanliness and hygiene. I think we have reinforced our knowledge about cleanliness, that how it can protect us from the pathogens like coronavirus and its spread. It's not only about this coronavirus, but in general, if we take regular shower, if we clean our nostrils, mouths, hands and feet after coming back from outside, and if we clean ourselves, especially with the water after we finish our toilet activities, then this will reduce the burden of pathogens, and eventually this will reduce the burden on our immunity. So it basically can help us to remain healthy. So finally, I shall talk about the importance of having a happy family. The people who are living in a happy family, especially the marital quality, if it's a very good and important predictor for inflammation, especially for the woman. If someone is having a happy family, their negative inflammatory responses are less, and they live a healthy life. Again, there are other studies which shows that stable and satisfying marriages contribute to the men's and women's improved physical and psychological health. It also has shown that marriage is good for health, while divorce can negatively affect our well-being, both mentally and physical well-being. It is very interesting to see that single status, those people who are not married, they tend to have a higher rate of mortality, or having less lifespan or shorter lifespan. So in summary, you can say that being a member of a happy family, it basically helps to boost our immunity in many ways to remain healthy. So with those list of boosting and damaging factors for our immunity, I would like to conclude this presentation by saying that please live a moderate life, stay clean, and be happy. Thank you very much for listening, and I shall be waiting for a lively discussion at the end of this session.
Thank you very much, Professor Tariq. That was a very interesting talk. Shall we smile, relax, put aside that cigarette and a glass of wine, enjoy a cup of hot tea maybe with our family, and stretch a bit now? Okay, since that's the recipe, we need to have a happy life. Okay, I'm sure there are a lot of questions. You can put them in the Q&A at the bottom. You just click that button for Q&A, and we will reserve the Q&A to the end of this webinar. I have a lot of questions for Prof. Tariq, but we shall discuss that later. Now, allow me to introduce the second speaker, Dr. Lau May Nak, who will introduce to us sleep apnea and what can be done about it. Dr. Lau May Nak is a lecturer and specialist orthodontist from the Department of Paediatric, Dentistry and Orthodontics, Faculty of Dentistry, University Malaya. She obtained her first degree in Bachelor of Dental Surgery, BDS, from University Malaya in 2008. She returned to University Malaya again in 2013 and earned her Master of Orthodontics with distinction, and also membership in orthodontics from the Royal College of Surgeons of England in 2017. She joined the University of Malaya as a lecturer the following year, is now actively involved in teaching of the undergraduate and postgraduate students, research, and treating orthodontic patients. One of her areas of research interest is Mandibular Advancement Appliance Therapy for Obstructive Sleep Apnea. So welcome, Dr. Lau, it's your floor.
Thank you for the kind introduction, Associate Professor Dr. Wei. Good morning, and once again, thank you for joining us this morning. I'm Lau May Nak from the Department of Paediatric Dentistry and Orthodontics, Faculty of Dentistry. Today, I would like to share about what I know on Mandibular Advancement Appliance for Obstructive Sleep Apnea. The outline of my sharing today will include an overview of obstructive sleep apnea, and of course, on mandibular advancement therapy mainly. So what is obstructive sleep apnea? It is also known as obstructive sleep apnea hypopnea syndrome, which is categorized by periodic reduction or cessation of breathing due to recurrent episode of partial or complete upper airway pressure during sleep. It results in oxygen desaturation and sleep fragmentation, which often terminated by arousal from sleep. The severity of obstructive sleep apnea can be quantified using what we call as apnea hypopnea index, AHI. It is determined by the number of episodes of apnea and hypopnea per hour during sleep, with apnea defined as 10-second breathing pause and hypopnea defined as a 10-second event where there is continuous breathing but reduced ventilation by at least 50% of the baseline during sleep. Mild OSA is categorized as having 5 to 14 events of apnea and hypopnea per hour, moderate OSA 15 to 30 events per hour, and severe OSA more than 30 events per hour. In Malaysia, it affects about 7% of individuals, adult population. However, as we know now that the prevalence of OSA is often underestimated and underdiagnosed, it may affect more than 7% of Malaysian adults. The common risk factors includes male obesity, increased neck circumference, respiratory and nasal congestion, smoking, muscle relaxant, alcohol, and sedatives. The common symptoms are excessive daytime sleepiness, ischemic heart disease, myocardial infarction, stroke, road traffic accidents, and even premature death. These are thought to be a cause of hypertension, the common symptoms are excessive daytime sleepiness, snoring, impaired alertness, and reduction in cognitive function, which are thought to be a cause of hypertension, and the list goes on as I have presented earlier. The screening of obstructive sleep apnea includes taking a simple sleep history, asking patient whether, or the bed partner, whether they snore significantly or is there any witness apnea. We can perform a simple upper airway examination or use a quick validated screening tools such as Epworth Sleepiness Scales, or stop bank, whichever that you are familiar with. Both are very simple, self-administered, only consists of the 8 items in the questionnaire. These screening tools aid in identifying the need for testing or diagnosis of obstructive sleep apnea. So how do we diagnose obstructive sleep apnea? Next, the definitive diagnosis of obstructive sleep apnea is commonly made by respiratory clinicians through polysomnography. So for my colleagues from the Faculty of Dentistry, we have to remember to refer them to our colleagues from perhaps the ENT department for definitive diagnosis of obstructive sleep apnea. Polysomnography is an overnight sleep study performed in a laboratory with computerized recorded technology. In PPUM, we do have this facility. It uses neurophysiological tests to examine sleep stages and arousal by monitoring brain activities, eye movement, muscle activity or skeletal muscle activation, heart rhythm during sleep. So I don't know much about polysomnography. Perhaps you can hear from our colleague from the ENT department next breakfast sessions. I would love to know how to, read all the graphs. But something more, I have research collaboration with researchers from the Ministry of Health. Some areas are without access to polysomnography or having a long waiting list of polysomnography. So at those areas, sometimes Hope sleep apnea tests are being utilized. It can be used to confirm a diagnosis of obstructive sleep apnea in patients with high risk of moderate to severe OSA based on sleep history or screening tool that we have discussed earlier. Besides, it is important to note that it is only for patients with no major medical problems or other sleep problems. It is a more readily available and also a less costly options. Besides, it is also more convenient alternative to polysomnography because it can be conducted at patients' house where the usual sleep take place. HSIT produce an estimate of severity, which is called Respiratory Event Index, REI, based on monitoring time. Unlike polysomnography, it determines severity based on sleeping time using AHI, the Apnea-Hypopnea Index. It does not include EEG sensors, which are essential to define sleep versus wake. It is important to note that it has been reported to have less sensitivity, thus it may underestimate the severity of the sleep-related breathing disorder, and it is unable to identify signs and symptoms in patients with mild OSA. Thus, in a nutshell, a negative or inconclusive HSAT warrants a polysomnography to ensure that a patient does not have obstructive sleep apnea. So what is the treatment for obstructive sleep apnea? Nasal continuous positive airway pressure, CPAP, remains the primary treatment, especially for patients with moderate and severe OSA. Side effects reported includes dryness, burning and irritation of nasal mucosa, and patient intolerance due to machine noise. Alternatively, when a patient complains of unable to tolerate the nasal mask, the conventional nasal mask, options available includes nasal pillows, oral mask, or even a face mask when nasal obstruction or dryness limit the use of a conventional nasal mask. If none of these alternatives are acceptable by patient or patient complaint intolerance, instead of letting patient go without any active treatment, do consider mandibular advancement appliance therapy. So mandibular advancement appliance therapy protrude the mandible, stabilize it in order to maintain a patent upper airway during sleep. By maintaining the mandible in a protruded position, display the tongue forward anteriorly via genioglossus muscle, changing the position of the hyoid bone, thus widening the upper airway space. As early as in 2006, the Cochrane Review has recommended its use to patients with mild symptomatic obstructive sleep apnea and to patients who are unwilling or unable to tolerate CPAP therapy. The latest clinical guidelines produced in 2019 by the American Academy of Sleep Medicine and the American Academy of Dental Sleep Medicine has recommended its use for patients with mild to moderate obstructive sleep apnea, and also next for patients with severe obstructive sleep apnea who do not respond to or are unable or unwilling to tolerate CPAP. If you follow the literature, the evidence, recently there are a few more systematic reviews and meta-analysis in 2017 up to the recent one, Rosie et al. 2021. The conclusions is the same. So, what are the main advantages of mandibular advancement appliance? It is thought to be more cost-effective, it is reversible, and relatively uncomplicated options for patients with mandibular advancement appliance who does not respond to CPAP or unable to tolerate CPAP. Despite side effects are reported during mandibular advancement appliance usage, they are usually mild, transient, and acceptable by patients. To note, responders to both CPAP and mandibular advancement appliance express a strong preference for mandibular advancement appliance. However, CPAP is still the first choice therapy for obstructive sleep apnea. Next, why? Because although compared to control, mandibular advancement appliance is effective in reducing AHI, improving minimum oxygen saturation, improving subjective daytime sleepiness, reducing systemic blood pressure, and health-related quality of life. When compared to CPAP, CPAP is still significantly more effective in reducing AHI and minimum oxygen saturation. Furthermore, there is a lack of high-quality evidence on MAA efficacy towards cardiovascular morbidity and mortality outcome. Therefore, further studies are needed to provide an answer to this question. I hope you're still with me. So next, let's move on to mandibular advancement appliance, a little bit more about this therapy. So there are two types. Next slide, please. There are two types of mandibular advancement appliance generally, the prefabricated one or a custom-made type. The prefabricated mandibular advancement appliance, also known as the boil and bite system, can be self-adjusted at chairside in your clinic to adapt to the shape of patients' teeth and dental arches. Due to the nature of its construction, it is actually less retentive, but it is also less costly because it does not involve a dental or orthodontic laboratory to construct the appliance. On the other hand, custom-made mandibular advancement appliance fits in the mouth optimally. This has been reported to be more comfortable and which contribute to increased compliance rate. So custom-made mandibular advancement appliance has shown more advantage over prefabricated mandibular advancement appliance in terms of reducing AHI and daytime sleepiness, improving adherence and quality of life. In fact, custom-made mandibular advancement appliance is the MA of choice recommended by the clinical practice guideline of AASM and AADSM. So as for custom-made mandibular advancement appliance, it can further categorize into two big groups, the monoblock or biblock. Next, I'll show you a figure, an example of a monoblock. Basically, monoblock mandibular advancement appliances are non-adjustable, cannot adjust or increase the mandibular advancement after its construction. It consists of one piece and it rigidly fixes the mandible into a fixed anterior position, a predetermined position. Next slide showing the biblock mandibular advancement appliance. Okay, biblock mandibular advancement appliance can be either adjustable, excuse me, or non-adjustable. So the larger figure on, I believe, your left shows an adjustable biblock. If we move on to the next slide, you can see that it consists of two interconnected pieces. When it is connected together via the device, the mechanism in the middle, patient can adjust. We can teach patient, or we can adjust for patient the increment or how much magnitude of mandibular advancement appliance we would like to achieve. Okay, moving on, next slide, which is the previous slide, comparing adjustable biblock with non-adjustable biblock. So on your right, the smaller figure showing a non-adjustable biblock. So for a non-adjustable biblock, it actually advances the mandible like the monoblock non-adjustable type into a predetermined fixed anterior position. So a little bit more about custom-made adjustable mandibular advancement appliance, which is a biblock type. Next slide, please. As I mentioned earlier, it must include a mechanism that are adjustable, that allow clinicians to adjust the magnitude of mandibular advancements amount. So the clinical practice guideline by AASM and AADSM has listed down the minimum requirement for a good or optimal custom-made adjustable appliance. The mechanism should be able to advance the mandible in increments of 1 millimeter or less, with protrusive adjustment range of at least 5 millimeter. It should allow two directions of movement, so advancement of at least 5 millimeter and allow reversal of advancement of at least 5 millimeter as well. And the protrusive setting should be verifiable. So if you are choosing the mechanism, if you are ordering or prescribing a custom-made adjustable appliance, mandibular advancement appliance, do make sure that the mechanism fulfills these criteria. A recent systematic review and meta-analysis, the next slide, reported that monoblock was actually more effective than biblock in terms of AHI, minimum oxygen saturation, success rate, and patient preference. However, we should also note that the quality of evidence are of low to moderate quality. Thus, more high quality randomized control trials are warranted for us to conclude this preference. So whether you are using or you prefer a non-adjustable mandibular advancement appliance or adjustable one, therapeutic position is essential. So if you are using a non-adjustable monoblock, you need to determine how much mandibular advancement you would like to prescribe for your patient. If you are using an adjustable type, you must know what is the initial mandibular position you chose at the time of issue when you are letting patient to go home with the mandibular advancement appliance. Therapeutic position is defined as a position, next slide, of mandible that achieve improvement of sign, symptoms, or objective indices of sleep-related breathing disorders. At this position, the appliance can be used comfortably by patient on a nightly basis. Multiple studies have attempted to determine the most effective therapeutic position or initial mandibular position in order to maximize success rate and minimize side effect, or for adjustable type to balance the adverse effect against the time required to reach an appropriate therapeutic position. So before we discuss about the most effective therapeutic position, there are a few terms that I have to bore you with. So therapeutic position is recorded as a percentage of maximum mandibular excursion from the posterior reference point to maximum protrusion. So what are these terms? Posterior reference point is the most retruded mandibular position. My colleague in the dental faculty know that it is also termed as retruded contact position or centric relation. On the other hand, maximum protrusion is the most protruded position of the mandible. So if you see the photo on the top, on the left, the smaller figure, it shows patients at the most posterior reference point, and on the right, the longer figure showing patients with the mandible at the maximum protrusion. So by measuring the distance between the upper and lower front teeth at these two positions, we will know what is the total amount of maximum mandibular excursion. So therapeutic position is recorded as a percentage of maximum mandibular excursion. Next, to date, there is actually no gold standard in the amount of mandibular advancement. It may range from 25% to 75%. Theoretically, the more the mandible advance, the greater the improvement of the condition of obstructive sleep apnea. However, with more advancement, patient may experience more complication or side effect, which will in turn affect their compliance, adherence to the therapy. Next slide. In the most recent meta-analysis of 13 randomized control trials, data analysis suggested that advancement greater than 50% did not actually influence the success rate. With this, clinicians should recognize that 50% of advancement may be greater than necessary for any individual patient, and we should consider decreasing the amount of advancement as long as the subjective and objective assessment of the breathing, the obstructive sleep apnea sign and symptoms do not worsen. So acknowledging and recognizing this knowledge gap, my team and I, we are currently conducting a research named effect of two different amounts of mandibular protrusion in obstructive sleep apnea patient using mandibular advancement appliance. So basically, we are measuring and comparing mandibular advancement appliance at two different magnitude, at 20% and at 50% of mandibular advancement appliance. My orthodontic postgraduate student, Dr. Chin Mei Hua, is conducting this randomized control trial, co-supervised by Prof. Mona Faid from Cairo University, Egypt, and our two beloved colleague from the ENT department, Dr. Revadi, and Associate Professor, Dr. Jayanti. So not only that, we are looking at the success rate, the outcome of various respiratory indices. We also record and compare quality of life indexes, adherence rate, and also side effects. So next, despite, like I previously presented, despite side effects are reported during MAA use, they are usually mild, next, transient, and acceptable by patients. So the side effects, these short-term side effects includes hypersalivation. Next, perhaps Dr. Sham, can you help me to put on the rest of the slides as well? Hypersalivation, dry mouth, and discomfort of teeth and temporomandibular joint. Some other inconsistent dental short-term side effect reported includes myofascial pain and also difficulty in chewing the next morning. Next slide, please. And how about long-term changes, long-term dental and occlusal changes? Recent systematic reviews reported that mandibular advancement appliance produces time-related, small, but statistically significant dental and skeletal changes for long-term. So the next slide shows an illustration of how these what type of long-term dental or occlusal changes that may occur to patient wearing mandibular advancement appliance in long-term. We should note that the evidence reported are of low to moderate quality. It ranged from 2 to 10 years of observation period. So they are still lacking of reports for more than 10 years of observation period. Dentally, the common reports includes reduced overjet, reduced overbite, which is due to which is caused by lower incisor proclination. Other inconsistent finding reports include upper incisor retroclination, downward and backward mandibular rotation, and increased lower anterior face height. Basically, the skeletal changes are generally secondary to the dental changes. As these changes are actually progressive slowly, many patients are unaware of the changes that happen to them. Thus, it is important and it is recommended that any patients who are wearing mandibular advancement appliance should be monitored by a qualified dental practitioner, usually an orthodontist, over time for the long-term side effect. Next slide. Again, the same recent clinical guidelines by AASM and AADSM recommended so as well. This is so that it can allow the dental practitioner to act timely and accordingly in order to reduce the incidence of these or any dental, occlusal or skeletal long-term changes. So my last slide, if you are looking for an orthodontist to review your patient for any long-term changes, or if you're looking for an orthodontist to construct and prescribe a mandibular advancement appliance therapy for your patient, please contact us. You can email me. My email address is shown on the slide. You can also WhatsApp us via our clinics line. Or you can go on to UMExpert and approach any of my lovely colleague from the Orthodontic Division, Department of Paediatric Dentistry and Orthodontics, Faculty of Dentistry. With that, I thank you very much for your kind attention. Thank you.
Thank you, Dr. Lau, for sharing with us about how the mandibular advancement appliance can be a possible adjunct to CPAP for sleep apnea. From the earlier presentation by Prof. Tariq, we know good sleep quality is also important in contributing to good immunity. Now I would like to invite Prof. Tariq back to join Dr. Lau for the Q&A session with all of us. Prof. Tariq? Okay, so I have here in the Q&A chat box the question for Dr. Lau. What is the cost of mandibular advancement appliance in PPUM?
You have to unmute.
Yeah, can you unmute, Dr. Lau? We can't hear you. Can you unmute?
Sure, thank you. Sorry. For your information, actually our moderator, Associate Professor Dr. Wei, is our head of department as well. Mandibular advancement appliance is a relatively new therapy. Right now, in fact, actually almost all of the patients that referred to me, we have been included to my postgraduate research. And a patient paid, of course, with the research grant, the price of the mandibular advancement appliance is partly supported by the research grant as well. But it is definitely way cheaper than CPAP. It may range actually from 100 to 500 depending on the design, the mechanism used, because the monoblock is definitely way cheaper compared to the adjustable type that required a mechanism that we purchase from the supplier. Different mechanism cost differently as well.
Dr. Chung,
I hope that I can have a more fixed price, but unfortunately we cannot do so due to the different nature and different various design of the appliance. Thank you.
Thank you, Dr. Chong. On B, you are very interested in this appliance for sleep apnea. His next question, when mandible is still in development stages, will mandibular advancement appliance affect the facial skeletal growth?
Okay, thank you for the question. Very important, in fact. So as you can see, mandibular advancement appliance, these are for adult obstructive sleep apnea. So for pediatric obstructive sleep apnea, oral appliance has not been proven effective. So it is actually not indicated for pediatric obstructive sleep apnea. However, if a child are having a small chin, a retruded mandible, and when the patient is growing at a suitable age from 10 to 14 years old, we do have a treatment that correct the malocclusion and hope to improve the skeletal discrepancy anteroposteriorly. And that treatment has reported to show a bonus in terms of improving obstructive sleep apnea if the patient is having it. But we are not actively using oral appliance to treat pediatric obstructive sleep apnea.
So Dr. Chong is also interested to know whether there's any changes in the dentition.
For adult obstructive sleep apnea, there is no permanent short-term changes, but on 2 years and above, we have reports from 2 to 10 years. We are not sure about more than 10 years. Within 2 years, we don't see statistically significant changes nor clinically significant changes. But from 2 years onwards, we do see statistically significant changes, but whether it is clinical significance, it varies as well. That's why the therapeutic position is important, because if we advance too much, of course, the long-term dental changes will be more significant compared to those who are at effective therapeutic position. But yes, in long-term, it does produce long-term dental, occlusal, and inconsistently skeletal changes.
So can this appliance be used in elderly OSA patient with dentures?
Okay, so there are two types of dentures. It depends on whether patient is fully edentulous, meaning having no any teeth for support. So basically, generally, we need some teeth to support and to retain the mandibular advancement appliance. However, we will work with our colleague from the implantology, from the other dental specialists, to work with a plan to perhaps insert some implants, dental implants, that can support mandibular advancement appliance. But yes, we'll work it out. But of course, for patients who have enough tooth to support the mandibular advancement appliance, the construction is way easier and less costly, because dental implant is costly as well.
So Dr. Chong is next interested in the soft tissue. We have covered skeletal, dental. So his question is, has anyone looked into the tissue hypertrophy, especially of the base of the tongue while using the appliance?
Hypertrophy, do you mean macroglossia as one of the etiology or potential risk factor of obstructive sleep apnea? Or do you mean whether there is permanent changes on the soft tissue? Anyway, by the way, macroglossia have been reported to be one of the common risk factor, but actually the incidence, the prevalence of macroglossia is actually low. As for whether it changes the soft tissue permanently, no. In the mandibular advancement appliance is relieve the symptoms. So patient have to actually wear it on a daily basis because it is not curative. But when patient wear it daily, it actually improved their condition of obstructive sleep apnea.
There's a question from Noor Faisal Ahmad Bahuri, which I think you have covered in the previous answers. It's related to would it change the facial feature? Would it change our bite? I think we have addressed that. So Dr. Rosie, our colleague, she asked whether the average or recommended amount of mandibular protrusion when taking the bite for the appliance.
Yes, now currently the recommended one is at 50%. It's at 50%. So you measure the maximum mandibular excursion, and then you take 50% of it. So it should be different for each individual patient because every patient have different maximum mandibular excursion. So you set it as 50%, and then together with your with our colleague from the either the sleep physicians or the ENT department from our colleague from the ENT department, we should together monitor the sign and symptom of obstructive sleep apnea, any improvement, and most of the time you should consider reducing it instead of increasing it from 50%. So we do hope that our randomized control trial, we aim to complete it next year. We hope that we have more lights. Whether any amount below 50% is actually equally effective, because the more advanced the mandible is, the more side effect patient experience that will directly affect compliance, adherence, and success rate.
Okay, another question from Elston Chong about compliance in patients. He says it's a bigger challenge using the appliance because of this. So how is it addressed?
Yes, actually, actually we have borrowed some tips and tricks that we use for other type of dental appliance. We also use, if you watch Charlie's in the Chocolate Factory, we also use headgear and stuff like that. It was shown that if we provide a diary for the patient to record their daily use, it actually improve compliance. However, it is actually a research reported on the use of headgear, not specifically to mandibular advancement appliance. So for patients struggled with compliance, adherence, when they say I keep on forgetting, we will teach them to set reminders, keep a diary, we will send reminders. It has been shown that if we send reminders, either in terms of in SMS or via call, can improve the increase the usage as well. So this is what we are looking at in our trials as well.
Then we would also ask the question about compliance to CPAP, which is the other alternative. Anyway.
So we do hope that you refer to us, because we take away some job from you. You do not have to follow up patients, whether patients is swearing or not. Let us do it for you.
Okay, and Pam Tan has got a question. At which stage of life does one develop sleep apnea?
Actually, there are two types: adult obstructive sleep apnea and pediatric obstructive sleep apnea. In fact, my daughter actually have a severe obstructive sleep apnea. I observe apnea, I observe choking, and snoring, everything when she was a baby, a few months after born. But that is how early can obstructive sleep apnea be observed. For adult, any stage, but remembering that older age is actually, middle age is actually one of the common risk factor. So it usually appears during, if one does not complain of obstructive sleep apnea, it might appear during their middle age era.
Okay, now we have a question for Prof. Tariq. What is a cytokine storm?
What is cytokine storm? I think in a certain infectious situation or infectious condition, a lot of cytokines are secreted at one go, and it could be, a combination of cytokines from both sides, like pro and anti-inflammatory cytokines. That is considered a cytokine storm in a general way.
I see. And Dr. Chong, I'm sorry, we have misunderstood his question earlier on. He's not talking about macroglossia. He says it's the compensatory mechanism when a narrow space is suddenly widened. Dr. Lau?
Yes, I'm here. Sorry, can you repeat the question again?
So he's not referring to macroglossia. Hypertrophy of the muscle is not referring to macroglossia. So he's referring to the compensatory mechanism when a narrow space is suddenly widened.
Compensatory.
I'm guessing again here that it means when we advance the mandible or the lower jaw with the appliance, it would suddenly widen the narrow space. And there's some compensatory mechanism with relation to the soft tissue changes, muscle.
Sorry, I must be frank and that I do not know how to answer that questions. Perhaps I should ask my colleague from the ENT department and find out more about that. Thank you for the question.
What we'll do is we'll email back to you, Dr. Chong, if that's all right with you. All right, we will email you. And I think we have addressed Elston Chong about the compliance of wearing the appliance a bit earlier. Okay, then Elston asked, how long do you have to wear the mandibular advancement appliance to correct the OSA problem?
Thank you for the question. Again, mandibular advancement appliance is not a curative therapy. It does not correct the mandibular advancement appliance. It relieves the symptom. This improve the respiratory indices, so the patient are not suffering from, apnea or hypopnea during sleep. This improving AHI, improving oxygen saturation rate, hypertension, and so on and so forth. So patients should wear mandibular advancement appliance basically for life, for an indefinite period.
All right.
Just like CPAP, actually, just like CPAP.
So we know a little bit more, and we have run a little bit late, like 4 minutes. It's supposed to finish at 9 anyway. If any of you have any other question, we can address to the speaker by email, because Dr. Lau has also revealed her email kindly to all of you. I thank you all for attending our webinar this morning. Stay happy, stay healthy. Please join us again next week at the same time for breakfast with UMHealth. Thank you.
Thank you, everybody.